Thank you, Muna. My name is Kohei Watanabe from Japan. Today, I'll introduce our research project and, of course, the collaboration with Yumna country. This is the introduction of our laboratory. Our laboratory have 3 postdoc and 1 lab tech and 2 secretary and 2 graduate school students and many undergraduate school students. Our laboratory have a community of all the population. This is one of the characteristics of our laboratory. So we organize the health and exercise school to the over 200 older adult members. So they become our research subject. And this is very important to recruit the subject. But during the talking with them, we found a new research theme from them. This is a very important thing. And also we have many collaboration with the private company. This is also very important to create a new research theme. And of course, we need to get the fund from these companies. And I want to introduce our city. Our city is Nagoya and Toyota City. Chukyu University have 2 campuses in Aichi Prefecture between Tokyo and Kyoto. So we have 2 campuses and the School of the Health and Sports Sciences in the Toyota campus. So Nagoya City and Toyota City is in Aichi Prefecture. You may know the name of the company, Toyota automobile company, and maybe you may not know the city of the name of the Toyota is from the company name. Yeah, this is the most valuable knowledge in my presentation today. So if you ask some Japanese, do you know the Chukyu University? Japanese may answer Chukyu University is very famous for the sports. So we have a gold medalist for the hammer throw. Professor Koji Muroshi got the PhD in biomechanics from Chukyu University, and he became the chief of the sports agency in the Japanese government now. And there are some medalists in the figure skates. And we have, of course, the outdoor track and the indoor track and the ice skate rink. And we have many students in the School of the Health and Sports Sciences. So in each grade, we have 750 students. And we have about 70 professors as a faculty member in this school. So let's start our research. So our laboratory's research topic is the prevention of the motor dysfunction in older adults. So we use exercise and food. And this is our originality that we research from the neuromuscular system. As you know, the skeletal muscle is controlled by the central nervous system. Muscle strength is determined by muscular and neural component both. This is representative data to show the importance of the neural factors. So this is the data of the order with the weight loss for the 5 years. Of course, they have a decrease in muscle mass and muscle strength loss. But you can see the speed of the ratio of the decrease in muscle strength is larger than the muscle mass. This means that the muscle strength loss cannot be only by the muscle mass loss. And this side, older with weight gain for 5 years, they get good muscle for 5 years. As you know that even the older, if they have good exercise, they can get their muscle. However, there are the muscle strength loss in these subjects. So this means in addition to the muscle component, other factors also should be considered to understand the decrease in muscle strength in the older population. This is a list of the potential site and the physiological mechanisms regulated strengths, and these are affected component of the aging. So in addition to the muscular component, neural component, like these type of the changes in the older population occurred. So in addition to the quantitative assessment of the muscular component, we needed to assess the neural component. You may know the quantification of the muscle mass is easy access for us. For example, the measure the circumference or the MRI or the ultrasonography. However, the assessment of neural component is very difficult, so there are no standard ways. But as shown before, we need to explain this gap. So the assessment of the neural component is very important. So this is a very classic data from the Professor Moritani and DeVries. Professor Moritani was my mentor when I was a postdoc in Kyoto University. So during the training session for the 8 weeks, you can get the increase of the muscle strength gradually. But the contribution to the of the muscular component or neural component are changing with the time courses. So at the first 2 or the 4 weeks, the contribution of the neural factor is very strong. And after that, the contribution of the muscle hypertrophy to the muscle strength gain is increased. And this is a young data. In older, there is a different pattern. So in older adults, there are the higher contribution of the neural component to the muscle strength gain comparing with the young adults for a longer period. So this may be the one of the important things that we need to quantify the neural factor in the older adults. This is from the textbook. Our new muscle contraction is controlled by neuromuscular system like that, from the brain to the motor neuron, and the motor neuron innervated to the muscle fiber. So you may know that this is the minimum unit of the motor control in our movement. So this is called as a motor unit. So for example, the biceps or the vastus lateralis, like a very big muscle, is consisted of the over the 5 or the 600 of the motor unit. So the control of exerted force is regulated by the number of the recruited motor unit and the excitation on the individual motor unit. So when we want to understand the neural system, it is important to quantify the motor unit activation, like the number of the recruited motor unit or the excitation of the individual motor unit. So each motor unit are innervated to the different types of motor unit. So this is related to the motor neuron cell size. So you know that this is the Henneman size principle. So if you want to raise a small dumbbell, like this, the small number of the motor unit is recruited. And if you want to increase the exerted force, the larger number of the motor unit will be recruited. So important thing is we need to recruit the fast twitch fibers with the very higher strong load. And you may hear the training session there. This is the training for the neural adaptation. In the sports science area, the many coach and the trainer said that. But what is a neural adaptation to for example, resistance training? So if you have a resistance training, our motor unit excitation is increased. So this contributed to the increase of your maximum force. And there are multiple motor units within a muscle. Their synchronization is increased following the resistance training. And when you're raising up the force quickly, the motor unit firing rate have a doublet firing. This is also one of the neural adaptation to the training. So like that, we have some the motor unit adaptation following the training. But how can we know this neural activation? As I said before, comparing with the muscular component, quantification of the neural component is difficult to understand. But of course, there is a method to understand the neural activation. This is the electromyography, like EMG. So EMG is mainly there are the two methods: surface EMG. We can put the electrode on the skin surface, and the intramuscular EMG. We inserted the needle or the wire electrode into the muscle. However, these methods have both advantage and disadvantage. So like that, surface EMG is non-invasive, so that we can apply to everyone. But the surface EMG is the interference signal from the multiple motor units. So it is difficult to understand the detailed motor unit or the individual motor unit excitation. So physiologically, the surface EMG have the limitation to understand the detailed physiological changes. On the other hand, intramuscular EMG is invasive, but they can get the detailed motor unit activation. However, even this intramuscular EMG technique, the detection area is very, very limited. So maybe we can get the 2 or 3 motor unit activation. So this is also one of the limitations of the intramuscular EMG. So these disadvantage in surface EMG and the intramuscular EMG may cover the how can I say that this is the limitation of the understand of the neuromuscular system in the human movement. So recently, the novel method for the assessment of neural activation is released. This is a high-density surface EMG. You may use it. So this is a very if you heard the name, this is a very complex one, but very simple. There are many electrodes inside one grid. So for example, in this case, the 64 channel of the electrode inside of the one seat. So just EMG, surface EMG detected from the many places. This is high density EMG. But one of the characteristics is inter-electrode distance is very short. So this means we can get selectively the electrical activation of the muscle. So simply if we apply the high-density surface EMG, we can get rich spatial information of the muscle activity. So this is an example of the biceps. On the biceps, there is a 64 channel of the electrodes, and the blue means lower activation, and red means higher activation. This means that there is an innervation zone on this area of the muscle. So this is the advantage that we can get the spatial distribution of the muscle activation. The standard surface EMG technique put a pair of the electrodes, so it is difficult to get the spatial distribution of the muscle activity. And also we can decompose the interfered EMG signal into the action potential of the individual motor units. Within the muscle, there were various innervation area. So the each action potential from the individual motor unit have a different action potential pattern within the muscle. And we can get the spatial and temporal rich information from the high density surface EMG. So we can identify the individual motor unit action potentials from the this high density surface EMG. So we can get the detailed motor unit firing pattern from the high density EMG without invasiveness. So the high density surface EMG have an advantage comparing with the surface EMG and the wire needle or the intramuscular EMG. So now let's introduce the motor unit recording using the high density surface EMG. So this is representative data of the action potential in biceps. So we attach the 6-4 channel of the high density surface EMG on the biceps. And here is the innervation zone of the this muscle. And you know the muscle fiber running is from the proximal to distal, this direction in biceps, so that we can see the how running the action potential from the innervation zone to the along the muscle fibers. So that we can visualize the action potential running of the individual motor unit using this technique. So from this signal or special the algorithm was used to decompose the individual motor unit like that. So this is a very simple scheme of the identification of the individual motor unit by the high density surface EMG. So after that, we can identify the when did each motor unit firing. So in this case, there is a line of the blue. So this is a timing of the firing of the individual motor unit. So like this, this line is performed the force. When we requested to perform the force gradually increase, we can get some information that, of course, the individual motor unit firing and when they recruited, when they started to activate it. This is a very important information. So using this type of the motor tasks, we can identify the type of the motor unit or the individual motor unit. We can categorize the individual motor units. So like that, of course, we can get the firing rate from the timing of the firing. And if we use like this, the ramp up contraction, then we can get the recruitment threshold. For example, this motor unit is recruited from the 30% of the maximal voluntary contraction. This means that comparing to these blue motor units, they contribute to the lower force. So following based on the size principle, this motor unit should innervate the slower muscle fibers. Of course, we can't say this is a slow twitch fiber or this is fast twitch fiber, but relatively, we can understand this type of the motor unit innervated to the relatively slower fiber type, and these are innervated the relatively faster twitch fiber like that. And also we put the electrode on the skin, so that if you mark the position of the electrode, even 1 month ago, 1 month later, we can get the same motor unit activation from the skin surface, so that we can track the same motor unit between the different time or different condition. This is one of the strong advantage of this method. So this is an example of the application of the high-density surface EMG multi-unit recording from our laboratory. So that you may know that all the have decreased multi-unit firing pattern. But in the previous study, didn't know that what type of the multi-unit is mostly affected. So that from our laboratory study, we found the multi-unit with lower recruitment threshold is strongly affected by the aging. So this is the opposite idea to the muscle fiber adaptation. You know that older population have a greater muscle atrophy in the fast twitch fiber. So that this is a different result of the muscle component and the neural component. Also, we investigated the relationship between the multi-unit firing rate and maximal voluntary contraction. In the young adult, there are no significant correlation between them, but in older adults, there is a strong positive correlation between them. This means that multi-unit firing rate, like a neural component, is a major determinant of the muscle strength in older adults. So that this data is reasonable when we think that older adults have a trainability in the neural component. And we applied the resistance training to the older adults. So at the beginning of the training, the older adults have an older pattern, like the different multi-unit overlap their firing pattern. But the 8 weeks resistance training make then the change of the multi-unit firing pattern among the different type of the multi-unit. This is like a change to the young pattern, the overlap to the open, we call the onion skin phenomenon pattern. So this is from the overlap the skin, and this is onion skin pattern. So we can reverse to the time from the older pattern to the young pattern. So this is very important. You know that older adults have if older adults have a resistance training, they can get a muscle hypertrophy. Like this, in the neural component, there is a reverse effect of the aging to by the resistance training. And I don't have any time today, so that I can't explain all. But we are now apply the nutritional supplementation on the resistance training in older adults. So the nutrition and food is very important to the prevention of the motor dysfunction in the older. So that we applied. This is a example, the whitefish, Alaska pork protein. So one of the Japanese company that sell the fish sausage made from the whitefish. So yesterday I ate King yeah. So we like the fish, so that we applied the fish. So normally, if the resistance training is applied to the older population, it is difficult to get to the muscle hypertrophy. So normally they can get to the neural adaptation only. But we used one of the group of the older population with resistance training. They got to the muscle hypertrophy. But this is the point. Neural adaptation was not occurred in this population. So this is very important. If we apply something to it, that we can change the target of the training from the muscle to the neuron, or the neural activation or the muscle. So this is the other study. We use the milk fat globule membrane. This nutrition contributes to the repairment of the change, age-related change is innervation area. So we use it, we can strengthen the neural adaptation of the resistance training in older adults. So we think that if we apply the same resistance training, we can get a different result due to the nutritional supplementation. This is a clinical study, so we also do the acute study. For example, you know the caffeine is most known ergogenic agent. So this is antagonist to the adenosine receptor and excitation of the central nervous system, and increase the calcium release, the efficient muscle contraction. So the caffeine acts on the neuromuscular system and enhance the physical performance. However, there is many evidences of the side effects. So of course, this is a very effective nutritional supplementation, but it is difficult to apply to the widely. So recently the quercetin is focusing. So this is a flavonoid in the vegetables such as onion, like that. So they play as an anti-oxidation and anti-inflammation. And in addition to the dysfunction, they have a similar action with the caffeine on the neuromuscular system in the animal, so that they can increase the calcium release in skeletal muscle and play as an antagonist to the adenosine receptor. However, the effect of the human neuromuscular system is not fully understood. So we applied this to the human and use the high-density surface imaging to understand the detailed neuromuscular system. So we use a double-blind crossover test in a healthy young subject, and they come to the different 2 days, and we applied the pre and post neuromuscular testing after the quercetin or placebo ingestion. So this is the main result. So as I said, we can track the same motor unit between the condition. This is a very important thing. So when we detected the same motor unit activation during the same motor tasks, we found after the quercetin ingestion, there was a decrease in the recruitment threshold of the motor unit. This means that, for example, if this motor unit is recruited from the 40% of the maximal contraction, after ingestion, we can recruit them from the 35 of the maximal contraction. This means that we can increase the recruitment of the number of the recruitment of the motor units. Also, we check the firing pattern of the individual motor unit. And after the ingestion, decrease in firing rate on the low threshold motor unit, and increase in the firing rate of the high threshold motor unit. This is very important. So in the caffeine study, the motor unit activation is regulated by the caffeine ingestion. But we didn't know that this type of the ingestion is what type of the motor unit is affected. So we found the different effect is found in different type of the motor unit. So we think if we applied the middle intensity of the exercise with the quercetin, we can get a similar neuromuscular activation of the high intensity exercise without physiological burden. So this is very important to the older adults because as I said before, the neural adaptation and recruitment of the fast twitch fiber is very important to the older adults. However, it is difficult to apply the high intensity resistance training to the older adults, even the athletes. So we think that this is one of the way to simulate or mimic the high intensity exercise without a high physiological burden. So of course, we applied this technique to the older adults mainly, and athletes now. And also, we can apply this technique to these type of the disease patients. So the last part of my presentation, in the last one, I will explain the advantage of recording area of the high-density surface imaging. So the surface imaging is generally recorded from the one electrode pair or muscle, or you can see the textbook, and you may have some classes about the surface imaging in the biomechanics or the exercise physiology classes. So the professor and including me teach to the student, okay, the pair of the electrode on the skin surface of the target muscle. So this is based on the idea homogeneous distribution of the different type of the motor unit or muscle fiber within a muscle, like that. If there are the three types of the motor unit, and they innovated the different types of muscle fiber. If they are homogeneously distributed within a muscle, if we put one electrode paired, you can get to the clean signal, and this signal is increased with the increase in the performed force. So the EMG amplitude can be used to estimate the neural input to the muscle. On the other hand, if the different types of the motor unit is heterogeneously distributed in the muscle, we can't be used this technique to estimate the neural input correctly. This is the case of the motor unit. So the most muscle is like this. So this is just a model, but we should know surface EMG from the one electrode pair is based on this idea. So this is the case of the monoarticular muscle. You know, we in our body and in other animals, we have a monoarticular muscle and a biarticular muscle. Monoarticular muscle is contribute to the only one joint movement. On the other hand, biarticular muscle contributes to the two different joint movement. Of course, there are the three totally articular muscle, but mainly we have a mono and a biarticular muscle in our body. And this biarticular muscle is contributes to smooth joint movement. For example, if we can do only the monoarticular movement, we can use the rotation of the movement only. But for example, I throw the ball and please catch like that. You can you use the two different joints simultaneously, and rotation and rotation makes a straight movement like that. So for the smooth joint movement, biarticular muscle is needed. So you know, the humanoid robot, they have not similar the human movement, so that they don't have the biarticular muscle. This is so the relationship to the pathological movement. So the biarticular muscle is also strongly related to the pathological movement pattern and higher risk of the sports-related injury. In the human biarticular muscle, rectus femoris muscle is one of the representative biarticular muscle. Or you can touch in front of the thigh. So this is a commonly injured muscle in the athlete, like a soccer player, and the cause of the pathological gait pattern in the CP patient. And various studies have focused on the activation property of this muscle. So rectus femoris muscle contributes to hip flexion and knee extension. So let's go back to the surface EMG model. So if the muscle fibers contribute to the each joint movement is separated, and the motor unit is also separated into the two different movements. If the homogeneous distribution of the motor unit of the muscle fiber within a muscle is here, we can get both information of the two different joint movements. However, if the like that heterogeneous distribution of the motor unit or the muscle fiber with the different types of the motor unit contribute to the different joint movement. For example, if this area is only innervated by the motor unit, it contributes to the knee extension torque. We can get the information about the knee extension torque, but we can't get the information about the hip joint torque. So EMG amplitude reflects one function only, but another function. So this is a misunderstanding of the neural input to the muscle. Of course, this is just a model, but we don't know this model. For example, the muscle fibers of the rectus femoris muscle is homogeneously distributed or the heterogeneously distributed. So this is an anatomical model of the rectus femoris muscle. You may not know that rectus femoris muscle has two separated proximal tendon. So you know that normally the one muscle have one proximal and one distal tendon. But in rectus femoris muscle, they have this muscle have two proximal tendon, like biceps. But of course, this muscle fiber is running to the common one distal tendon, like that. However, the muscle fibers from these different tendons is completely separated. And we checked in the human catheter, so there were the completely different part of the muscle. So this anatomy is known from the old studies. So that they express this anatomy, the muscle within a muscle. So the rectus femoris muscle have the two heads. Also, this two heads of the muscle component of the rectus femoris muscle is innervated by the different motor nerve branches. So we think possible independent action or neural input within a muscle in a rectus femoris muscle. So we applied high-density EMG technique to this muscle to confirm the activation and region-specific activation. This is first study for us, so that we use the full number of the electrodes. So that we put the 128 surface electrode on the skin surface of the rectus femoris muscle. The position of the rectus femoris muscle is identified by the ultrasonography. So this is the result. During knee extension, the proximal part of the rectus femoris muscle have a low activation, but the middle to the distal part have a higher activation. While the during hip flexion, there was the selective higher activation on the proximal regions. This means the region-specific functional role within a muscle. So proximal contributes to the hip flexion, and the middle to the distal contributes to knee extension. So you may think that, but this may be affected by the crosstalk from another muscle. So the reviewer of this article said this may be the tensor fascial. This muscle, another muscle is this. So that we checked again using the invasive technique. So that we inserted the wire electrode to the proximal, middle, and distal region of the rectus femoris muscle and performed the same task of the high-density EMG study. So we confirmed the same results, i.e. during hip flexion, the selectively activated in at the proximal region. So we think Okay, this phenomenon is correct. So next, we applied this idea to the dynamic movement. So during the working, this is the data of the heel contact to the heel contact. And the y-axis means the longitudinal axis distance of the rectus femoris muscle. The upper part is the proximal, and the lower part is the distal. So during the heel contact, you know that we need a knee extension torque to support our body weight. So there is activation around the middle to the distal region of the rectus femoris muscle. This is very similar during the similar activation pattern of the during the isometric knee extension. And after the toe off the beginning of the swing phase, we need a hip flexion joint torque. So there was activation around the proximal side of the rectus femoris muscle. This is similar with the activation pattern during isometric hip flexion. So in dynamic movement or in the daily life, we use the region-specific activation within the rectus femoris muscle. We also confirm the reflex pattern is also different between the proximal and the middle to distal side of the rectus femoris muscle. So finally, we found that there was a heterogeneous distribution of the motor unit or the muscle fiber with different functions along the rectus femoris muscle. So we published the invited review paper in the exercise sport science reviews from the American College of Sports Medicine. So finally, we show the guideline of the surface EMG to the rectus femoris muscle. So if you want to understand the rectus femoris muscle activation, you should put the electrode to the two different positions to understand that these two different joint torque related the muscle activation of the rectus femoris muscle. So one side of the muscle length is one of the criteria, and if you put the electrode on this area, you can get the muscle activation related to the hip flexion. And if you put around there, you can get the surface EMG signal related to knee extension. So we applied also the effect of the aging of the walking. So this is the data from the young and older. So when we focusing on the swing phase, the young adults selectively use the proximal region. And older adults have a selectively activation of the proximal and additional activation of the distal region. So this means the young adults can selectively produce the hip flexion during the swing phase. But the older adults may create also hip flexion and the knee extension also. This may be the cause of the falling on the shrugging of the older population. So with the collaboration of the UMNA, we applied this idea. So the stroke or the CP of the CI patient may have a different or the pathological regulation of the rectus femoris muscle. So we hypothesize that maybe these patients can't selectively activation of the proximal and the other region of the muscle. So this may be the one of the reason of this type of stiff knee gait. So if we understand this, we can apply this idea to the buttocks like that. So thank you for listening. And as Yumna introduced, we organized the ISEC 2024 in Nagoya City. So I want to meet you in this meeting. So we are very welcome to come to Japan. Thank you.